Hey friends, Dr. Nixon here. Welcome to the Winston Wellness Summit. You can check out our other episodes on YouTube and Facebook, all the other health experts that we've interviewed. Super grateful today to introduce you guys to one of my amazing friends, incredible chiropractor. She's an incredible leader, an incredible doctor, a lot of amazing things. She's a Spartan race runner. I think she recently placed, in her age group, I think she was the top 3 in her age group in a Spartan race recently. She is stronger than me. I've never beat her in a CrossFit workout ever. Her name is Dr. J, and she is talking about chiropractic care in pregnancy. Hey, Dr. J.
Hello.
Is that true? I've never beaten you in a CrossFit workout? I think that's definitely true.
Slightly true. Maybe. I'm not 100% sure anymore.
I mean, I may have beaten you once. That doesn't really count.
Okay, once. I'll give you that.
You're one of the strongest people I know for sure, in your heart and in your muscles, but your heart's a muscle too. So today we're talking about chiropractic care in pregnancy. So I've never been pregnant, obviously, but my wife has, and you and Dr. T have taken care of her through both of our pregnancies. And it is honestly, I don't think I can tell you enough. It's one of the things I'm the most grateful for, to have someone love and care for my wife and my family. It's so grateful for you and want to acknowledge you for all the work you've done, the classes you've taken, the extra classes you've taken to pour into yourself and become a really amazing version of yourself as a chiropractor and a doctor. So really grateful for you. But chiropractic care in pregnancy. So people who have no grid at all for chiropractic care, but especially not during pregnancy, give us a little bit of why in the world a pregnant person, mom, would ever go to a chiropractor.
Yeah, so I think the biggest thing that I get excited about as a chiropractor is when we get to be a part of a pregnant mom's birth team. I think the important thing is that we are there alongside them to help support them and help them have the healthiest pregnancy that they possibly can have. And so when a pregnant mom comes in, they will, go through a chiropractic analysis. It's actually called the Webster's technique, which is an analysis that myself and Dr. T do because we're Webster certified through the ICPA, which is the International Chiropractic Pediatrics Association. So we are certified in this specific technique. And what it is really a sacral pelvic alignment and really assessment to see how well things are working together with the bones, muscles, and ligaments of that surrounding area, so that your pelvis is balanced as possible, so that way when delivery comes, everything can be as smooth as possible.
So, with the pelvis and sacrum, give us, why is that important for a pregnant mom and delivery?
Yeah. So when we're looking at the hips, when a mom comes in, if your hips are misaligned, for example, if one hip is higher than the other, if one is rotated, that is also going to throw off the sacrum or your tailbone. And then that can just decrease or change the size and the shape of your pelvic bowl in general, which therefore can make the delivery process just a little bit more difficult for the baby. Or if your muscles and ligaments also that are attached, such as your round ligaments, your sacral tuberous ligaments, if those are tight or your psoas muscle is tight, then that doesn't allow enough room for the baby to move and turn into that head down position. Therefore, again, making birth a little bit harder or more difficult, or maybe even not even possible for the baby to turn head down.
So, I've heard of like breech babies, or I think that's what it's called, right? Breech, or like sunny side up, or different positions. Yeah. Is that caused by like pelvic misalignment and restriction, or how does that all work?
So I do think that a breech baby could be potentially caused by some of those restrictions or misalignment, whether it's through the spine, through the hips, through the muscles, through the ligaments. And don't get me wrong, because this Webster's technique that we use is not to turn a breech baby. Like, we don't actually manipulate the baby. We don't force the baby in any way. All it is gentle adjustments and realignments of mom's hips, pelvis, muscles, ligaments in that surrounding area, so that the baby has the ability to turn head down when the time is ready.
Gotcha. Okay. That makes so much sense to me. What I'm hearing is baby knows what the baby's supposed to do and going head down. Your job is just making enough room or removing any restrictions or roadblocks that would be in the baby's way and allowing baby to do what baby's going to do. Is that what you're saying?
Absolutely. Like roadblocks is a good one. And plus, as the mom gains weight, right, you have more pressure on the anterior aspect of your body or the front because of the weight gain. So therefore, this can put more pressure even through her pelvis and her knees. That can cause pubic symphysis dysfunction, which is pubic pain. Essentially can be radiating or sharp or even dull and achy. Same with sciatic pain. You're putting more pressure on your sciatic nerve and your glute muscle. So the Webster technique can actually help address these issues, help realign mom so that she's not dealing with discomfort and pain throughout her pregnancy.
I mean, it's fascinating. One of the things you said earlier was, you love being a part of people's birth team, which I think is so special and cool. And obviously, just through our 2 pregnancies with my wife, it was really amazing to see people come alongside her. You guys, Dr. T, our midwife, her name's Courtney Long, incredible people come alongside of us and just to say, hey, like, birth is incredible. Pregnancy is amazing. You need some support. This is new territory. Things are going to feel different, look different, be different. But ultimately, it can be a really beautiful experience, just getting educated and empowered along the way with taking care of themselves. So give us a few things that moms can do during pregnancy that would just be really helpful to them physically or emotionally that maybe some moms aren't thinking about.
I always think movement's a big thing. Just making sure that if you are active before pregnancy, just stay active. Keep walking, keep moving, even well into your 3rd trimester. Walking and moving can be super important just for your own health, but also blood flow and the baby's health. So that's one big thing, I think. Some other things that you may or may not be doing along with your prenatal would just be adding in extra vitamins. So vitamin D is not only good for your immune system, but also the baby's immune system. And it can help with their bone health and development as well.
Did you say vitamin D?
Vitamin D3. Yeah.
It's good for mom and baby?
Good for mom and baby.
That's teach us about that. How's it good for the baby? Like when the baby's in the mom's womb or afterwards, or both?
Both. So we're talking developmentally. It can help with the bone health of the baby as the baby is growing in the womb. And actually, so speaking of that, just with moms, taking magnesium can be super helpful, not only with blood flow, but magnesium is a good thing so that the baby can actually absorb more nutrients through the placenta. So magnesium is something great that you can add in. And it can also help with leg cramps or restless leg syndrome as well. So again, extra magnesium could be helpful.
That was a big one for us with Marissa, was the magnesium. I think it was a 2nd or 3rd trimester. I think you guys told her, hey, take extra magnesium. It can help, but it helped with circulation. It kept swelling down. It helped muscles from, hurting and cramping. Magnesium was a big one for sure.
Yeah. So 2nd trimester is when I would add magnesium, but you can even do it in your 1st trimester for sure.
Cool. What else?
Something you would want to add in would be probiotics. So again, it'd be great to start with it, but if you're already in your 2nd or 3rd trimester, adding in probiotics would be great. It helps get you ready for that group B strep test. And it can also actually help with your gut health and vaginal health. And so that probiotic, right, as the baby is coming out, hopefully through the birth canal, they will get a gulp of your probiotics. So essentially coming through the birth canal, the baby will get some of your probiotics.
Wait, what?
What do they call that? The birth gulp to help. So as the baby is coming out of the birth canal, they will get some of your bacteria that's in your body as well. And that bacteria actually helps set them on the right step when it comes to their immune system. So the baby is actually sterile until they come through the vaginal canal. If they're delivered C-section, they're not going to get the probiotic gulp, but through the vaginal canal, they will. And so that is really great for their immune system.
You just blew my mind. That is crazy. That's fascinating.
Yeah.
So babies are sterile. They come through the birth canal. They ingest or gulp mom's probiotics.
Yes.
And that's their immune system. So the stronger, I've heard this before, the stronger mom's immune system is, the stronger the baby's immune system will be.
Yes.
So
correct.
Taking probiotics through pregnancy can help that. Fascinating.
Yes.
Okay, I was a C-section baby.
Me too.
So you too. Okay, we turned out decent, right? So
I think so.
we do believe this. All moms are superheroes. I don't care how you deliver a baby. But so if I go back in time, my mom didn't know any of this stuff, probably, right? So C-section baby, I come out. Is that why my immune system's not as good? Is that what you're saying? So what can a mom do if she's gonna have a C-section for whatever reason?
Sure.
And no shame over it, but she's having a C-section, baby comes out. How does the immune system get developed then, or is there something that mom should do, or how does that all work?
So if I were mom, if you're breastfeeding, I would even take your own probiotic, or getting a probiotic specifically for the baby. You'll want to look for the words bacteria infitis, and that is a good strand of bacteria for your baby to help build their immune system. So bacteria infitis.
So I love doing, even right now in functional medicine school, I'm doing so much on probiotics and probiotic health. Like, it is fascinating how much probiotics can help us. And so getting a baby set up for success from the beginning with getting probiotics in their body is amazing. I love that. That's so cool. You got any other fun facts on moms and babies?
Fun facts. I'm sure there are. I just can't think of any off the top of my head.
I'm just really like, wow, that's so fascinating. Cool. All right, I got some questions for you.
Sure.
I hope you're ready. They're rapid fire. This was so helpful and really, really interesting. And even for me, I learned a lot. I hope this was good for everyone else. Just understanding pregnancy, chiropractic, why you guys adjust pregnant moms. Obviously for pain, getting rid of sciatic pain, getting rid of low back pain, pubic symphysis, you had mentioned that.
Yep.
But also setting up delivery, setting up mom for success and being part of the birth team. And then I'm sure recovery is a big part of that process as well. All right. If you could buy any food right now, what would it be?
Steak.
How do you like your steak cooked?
Medium, for sure. With veggies, maybe French fries. And there. Cool.
Did I lose you? Okay, what color is your toothbrush?
What color? Blue and white.
What animal would you be and why?
A wolf, because they're stealthy and nocturnal. I have no idea.
What's the number one thing on your bucket list?
Cool. Sorry, I missed it.
What's the number one thing on your bucket list?
Bucket list. Ooh. Pass? Yeah. I get nothing for that one.
Who's your favorite superhero and why?
Spider-Man, because he got bit by a spider. He can essentially fly, but he can also climb up walls.
You're the best. All right, give me one thing that you'll do for your health the rest of your life.
Workout.
Workout. Love you, Dr. J. You're amazing. You're the best. Appreciate you. See you guys. Go check out the rest of the episodes on Winston Wellness Summit. See ya.